Dementia related to dietary deficiencies or metabolic disorders. About 70% of the risk is believed to be genetic, with many genes usually involved. As many as 50% of FAD cases are known to be caused by 3 genes located on 3 different chromosomes. More than 90% of cases of AD are sporadic and occur in individuals older than 60 years. The time from diagnosis to death varies from as little as 3 years to as long as 10 or more years. When you are in your 20s, you begin to lose brain cells a few at a time. For 50 years after Alzheimer described the first patient, the disease was considered relatively rare. The clinical symptoms of dementia. Lewy body dementia is the second most common type of degenerative dementia found in the elderly. When a person is affected by more than one dementia disorder, the dementia can be referred to as a mixed dementia. The person with dementia may lose interest in once pleasurable activities and become more passive, depressed, or anxious. The symptoms of canine dementia are extensive, ranging from mild to severe as the disease progresses. The underlying causes of nutritional, hormonal, tumor-caused, or drug-related dementia may be reversible to some extent. In more advanced dementia, the person may lose the ability to get up and move, or the interest to eat or drink. A variety of health care institutions. Opportunities for maintaining optimal cognitive health are growing as public health professionals gain a better understanding of cognitive decline risk factors. People who take benzodiazepines chronically for anxiety, which is not recommended, can also develop more chronic cognitive impairment. Learn to make sure BP is measured accurately, what BP to aim for, and what to ask the doctor. Whether you suffer from a mental health or degenerative condition, it is important to note that anxiety is a feeling that is normal among the general population. The role of public health in enhancing the physical health of older adults is well known. Relatively quick and inexpensive, the case control design is a standard epidemiologic approach used to identify potential risk factors and to determine whether more extensive studies are warranted. The successful care of individuals suffering from dementia. There may come a day when your loved one can no longer be cared for at home. Dementia care is a daunting task, but may not be as challenging as you expect. The key to dealing with dementia is high-quality, comprehensive care that will help the patient feel more comfortable and safe. Having a conversation with a person who has dementia can be difficult, and it may take longer than usual to conclude. You may want to think about respite care, when the person you care for goes to stay in a hospital or care home for a short while, perhaps a few days or weeks. When a person with dementia wakes up in the morning, it is very helpful to have the day on display in addition to the time. A hospital or care home. Most families eventually need outside help to relieve some of the burden of around-the-clock care for a person with AD. Once a senior is admitted to assisted living, a care plan is put in place. Even a 5 to 10 minute walk is a good starting place, and you can build from there. 4 different genes have been definitively associated with AD, and others that have a probable role have been identified. The man did fine when allowed to sleep until 10, then given a light breakfast. Since cough or cold medicine is taken when needed, you may not be on a dosing schedule. The most important clinical research. A dose of 23 mg per day should not be administered until patients have been on a daily dose of 10 mg for at least 3 months. To help you cope with caregiving responsibilities and to manage your stress, it is important that you remember to take care of yourself. To remember a task you need to do in the future, you could try creating a vivid mental image of it actually happening. As the disease progresses, patients have more difficulty verbalizing their wants and needs to others. As the condition progresses, the care requirements for individuals stricken with the disease vary significantly. Perhaps you are interested in the treatments currently available, or the risk factors for developing the condition. The future of dementia care. A person needs to have at least 2 types of impairment that significantly interfere with everyday life to receive a dementia diagnosis. The column does not constitute medical advice and is not meant to diagnose, treat, prevent or cure disease. Though many conditions may have similar symptoms to dementia, not all are considered to be dementia. A genetic test for the APOE4 gene is available but is not used for diagnosis, since possessing even 2 copies does not ensure that a person will develop AD. When someone you care about has dementia, their memory loss is affecting their daily life. The procedure is usually done with use of a local anesthetic, so it is not very painful. Mental well-being of older people in care homes. People with dementia are no exception, but increasingly need the support of others to participate. People with dementia who may have difficulties making decisions are still entitled to receive self-directed support from a local authority. People with the disorder may become confused, suspicious, agitated, depressed, fearful, anxious, withdrawn, or angry. A clinical report is any variety of clinical analysis together with people paying very little heed as to if it is associate in nursing and intercession. Caregiving can have positive aspects for the caregiver as well as the person being cared for. For people with dementia, providing caregivers with coaching on managing difficult behaviors can also help. Its science and research activities and its employees. Each trial answers certain scientific questions in order to find new and better ways to help cancer patients. In a brief appointment, the physician often cannot detect all the problems that your loved one has been experiencing. Specific medical advice will not be provided, and NLM urges you to consult with a qualified physician for diagnosis and for answers to your personal questions. Everybody has the right to be informed about medical diagnoses, even if the diagnosis is hard to cope with. The drug pipeline was coming up dry, and researchers were not encouraged to think big or bold. Several ongoing clinical studies are helping researchers better understand the dementias and find better ways to safely detect, treat, or prevent dementias.